Webinar on percutaneous coronary interventions. My name is Jennifer Boniface, and I'm one of the nurse analysts with the Provider Outreach and Education team. Today's webinar is going to focus on the coverage criteria and documentation requirements related to local coverage determination L34761 percutaneous coronary interventions. I have a few housekeeping items to go over with you before we start the webinar. You can find the link to the encore presentation of this webinar on our website's Training Center page, where it will be available for the next 60 to 90 days. Additionally, the recording will be uploaded to our YouTube channel under the Encore Presentations playlist. Both of those should be available within the next 15 business days. If you have any questions, please put those questions in the chat feature and select Send to all panelists. We will answer questions as time permits. Should we be unable to answer a question during the webinar, we will create a follow-up document and send it to all attendees afterwards. And I did incorporate some of the questions pre-submitted questions into the presentation. We really want your feedback. It helps us develop the education on topics that may be of interest to you. Consider taking our survey to let CMS know what you did like and what topics you'd like to learn more about. Aline will place a link to the survey into the chat. There will also be an opportunity at the end to take the survey. Additionally, you can provide feedback by completing the survey while viewing the encore presentation. To access the survey, click the circle with the eye in the upper right-hand corner of the video, and the link to the survey is also found in the description of the video. On this slide, we have our disclaimer. Medicare rules change often, so please make sure you're looking at official CMS communications for the most up-to-date rules and regulations. These do take precedence over anything that is presented today. And as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be posted on the Training Center page of our website under Encore Presentations, as well as on our YouTube channel under the playlist Encore Presentations. On this next slide, you will see there are several different acronyms used during this presentation. Many of them you might already know, but if you find an acronym we discussed today that you are unfamiliar with, please refer to the slide for guidance. Percutaneous coronary interventions are minimally invasive procedures used to open narrowed or blocked coronary arteries. They assist with reducing symptoms such as chest pain and improving overall heart function. During today's webinar, we will discuss the coverage criteria and documentation requirements associated with LCD L34761 for percutaneous coronary interventions. We will cover background information on percutaneous coronary interventions, coverage and limitations, and documentation requirements. We're going to begin with a little background on the cardiovascular system as it pertains to coronary disease. The role of the arteries is to transport oxygen-rich blood throughout the body. When fatty, waxy deposits, also known as plaques, build up in the arteries, such as in the case of coronary artery disease, the arteries can become blocked. As the plaques accumulate, they narrow and harden the arteries, leading to a condition called atherosclerosis. This narrowing and hardening inhibits adequate blood flow within the body, and as a result, issues such as chest pain, shortness of breath, fatigue, and eventually heart damage can occur. If not addressed, these issues can progress to more severe conditions, including myocardial infarctions and heart failure. Percutaneous coronary intervention, also known as coronary angioplasty, can be performed to treat this issue. This procedure involves opening blocked arteries with the goal of restoring proper blood flow within the body. During a PCI, the interventional cardiologist threads a catheter with a deflated balloon or other device through the inguinal femoral artery or radial artery to the location of the plaque obstruction in the heart. X-ray imaging guides the catheter's path. Once at the blockage, the balloon is inflated to compress the plaque against the artery walls, thus widening the artery and restoring blood flow. A stent can also be placed during the procedure to ensure the artery remains open permanently. This stent may be coated with medication that gradually releases into the bloodstream to help prevent blood clots from forming within the stent. An example of a type of percutaneous coronary intervention is percutaneous transluminal coronary angioplasty, or PTCA. A PTCA is a minimally invasive technique used to open blocked coronary arteries and facilitate sufficient blood flow to the heart. Before we go into coverage information for percutaneous coronary interventions, I want to show you how to find the LCD. We use this LCD when making determinations regarding percutaneous coronary intervention claims. There are two different ways to find this LCD. The first place is on our website on the homepage. So I'm going to go there now to show you how to access this. If you go to the left-hand side of the screen right here, you'll see that we have a code lookup tool section. If you click the radio button next to LCD and article lookup, and then add in the code, title, or description you want in the text box. And I already typed in percutaneous coronary interventions. Next, we will click the search button. Once you click the search button, look for the LCD you want to view and click that title. So I'm going to choose Percutaneous Coronary Interventions L34761. And this will take us to our tools section of our website. The LCDs and the billing articles, if available, will be found on this page. You can also look up the LCD that you want to see by just going to search another code, but since we went through the home page, it automatically comes up for us when we go to this site. Once you find the correct LCD, you're going to click that link, and that will take you to the selected LCD within CMS's Medicare coverage database. So I'm going to do that right now. Be sure when you get into this LCD that you click this down arrow next to contractor information to make sure that you're in the correct policy for your jurisdiction's MAC. And our LCDs will have the contractor name of Wisconsin Physician Service Insurance Corporation. And if you want to save this LCD for future reference, or if you're going to go in and out of different pages on here when you're looking at this LCD, you can click this basket right here, and it will add the document to the basket for your MCD. Okay, next, let's go to how to look on the MCD. So the other place where you can find LCDs is by going to the MCD, which is our Medicare coverage database on the CMS website. I'm now going to go there to show you how to access this LCD in the Medicare coverage database. So in this one, you're going to enter a keyword, code, or document ID in the text box. Now, as you can see, I've started putting percutaneous. I'm going to start putting coronary. And you can see it will pop up. You'll see two different policies that pop up on here. You are going to select the WPS policy because that's your jurisdiction, which is L34761. So I'm going to click that. And again, it takes you to that LCD. When you go to that LCD, if you go right through the MCD website, you do want to click down again to make sure you're in the correct contractor. And again, we can see that because it says Wisconsin Physician Service Insurance Corporation. I'm going to scroll down and show you what information you can find in here. So in this LCD, we can find coverage guidance, including indications, limitations, and our medical necessity. So here's our overview, our indications, our limitations, our documentation requirements, utilization guidelines, and then a bibliography. And again, you can add this to the basket. We already have it in the basket, but I can show you, you can add it again to the basket so that you can save it for future reference. So let's start with the coverage criteria found in LCD L34761, Percutaneous Coronary Interventions. Percutaneous coronary interventions may be used to treat patients with the following conditions: acute coronary syndrome, such as acute myocardial infarction or unstable angina, history of significant obstructive atherosclerotic disease, restenosis of coronary artery, previously treated with an intracoronary stent or other revascularization procedure, chronic angina, or silent ischemia. Intracoronary ultrasound, also known as intravascular ultrasound, is a procedure that uses sound waves to detect narrowing and blockages that may impair blood flow. It may be covered separately when necessary to evaluate the severity of coronary stenosis if angiography results are inconclusive, or to assess the patency and integrity of a coronary artery during a percutaneous coronary intervention. The extent of stenosis in a vessel can also be assessed using either intravascular Doppler velocity measurements, pressure-derived measurements of coronary flow reserve, or a combination of both. Intracoronary ultrasound or fractional flow reserve measurements should be conducted on the appropriate artery as clinically necessary. Both procedures are only considered medically necessary if written documentation supporting the medical necessity is provided. Additionally, intracoronary ultrasound and Doppler fractional flow reserve studies may be required for patients with multivessel coronary artery disease. A diagnostic cardiac catheterization to evaluate the characteristics of the lesion before the percutaneous coronary intervention is also covered. This procedure can be performed at any time before the PCI, including on the same day as the percutaneous coronary intervention. Performing both procedures on the same day is often used in practice to optimize patient care, particularly in situations where immediate intervention is warranted based on diagnostic results. If the diagnostic catheterization is performed within 30 days of the percutaneous coronary intervention, repeating the catheterization is typically not required unless there is a documented change in the patient's condition. However, barring any valid reasons for delaying the percutaneous coronary intervention, such as a need for additional treatment planning, further evaluation of angiography, excessive dye load, or transfer to another care facility, it is recommended to perform both procedures during the same visit when medically appropriate. Additionally, a detailed and comprehensive discussion of the risk and benefits of percutaneous coronary intervention should be conducted prior to proceeding with the procedure. The decision whether to perform the procedure in stages on separate occasions rather than all at once should be determined by the interventional cardiologist based on specific clinical needs of the patient. Documentation should clearly indicate the reason for postponing a recommended percutaneous coronary intervention. Separating these procedures to avoid multiple surgery pricing or for scheduling convenience is considered inappropriate and may lead to a review and denial of medical necessity for the services. Finally, a repeat diagnostic catheterization within 3 months of the last procedure and before a percutaneous coronary intervention is typically not eligible for reimbursement and is deemed neither reasonable nor necessary unless there are new indicators such as a new clinical event, change in symptoms, or an abnormal examination or test results. Before we move on to non-covered services, I want to review some additional information found in LCD reference article A57479, Billing and Coding Percutaneous Coronary Interventions regarding billing and reimbursement. A link to this resource will be placed in the chat. Coronary thrombectomy, when performed in conjunction with PTCA and stent insertion, is separately reimbursable. Additionally, coronary thrombosis, including coronary angiography, administered via intracoronary infusion, if performed before or after PTCA or atherectomy, is also separately reimbursable. Diagnostic coronary angiography conducted in a separate session from the interventional procedure is separately reportable. Diagnostic angiography conducted during a coronary interventional procedure may also be separately reportable if it meets one of the following conditions. No prior catheter-based coronary angiography study is available, and a full diagnostic study is performed, and the decision to intervene is based on the diagnostic angiography, or a prior study is available, but as documented in the medical record, the patient's condition with respect to the clinical indications has changed since prior study, or there is an adequate visualization of the anatomy and/or pathology, or there is a clinical change in the procedure that requires a new evaluation outside the target area of intervention. Additionally, LCD reference article A57479 reports several procedures that would not be eligible for separate billing. The first is angiography performed during the procedure to monitor the course of the intervention. This procedure is considered part of the PCI and cannot be billed separately to Medicare. However, it may be eligible for separate payment if no prior catheter-based coronary angiography study is available, or if the previous study is no longer sufficient due to changes in the patient condition. Next is the use of a device for distal embolotic protection during the interventional procedure, since it's considered part of the more complex procedure and therefore is not eligible to be billed separately. The third procedure is prophylactic insertion of a temporary transvenous pacemaker, as well as repositioning or replacement of catheters and administration of medications during the procedure. These are all included in the procedure and cannot be billed separately. The fourth procedure not eligible for separate billing is intracoronary injections of drugs during diagnostic or therapeutic procedures. These injections are deemed to be part of the procedure and are not separately billable. Next, coronary thrombectomy is bundled with atherectomy according to the CCI edit tables and is not separately billable when performed together. Similarly, thrombolytic infusion is bundled with stent placement on the CCI edit tables and cannot be billed separately when performed with an intracoronary stent placement. Finally, the use of percutaneous vascular closure devices to close an arterial puncture site after angiography, cardiac catheterization, or interventional cardiology procedures, whether it is used in addition to or instead of manual compression, mechanical clamps, sandbags, or combination of these methods, is considered part of the invasive procedure and not eligible for separate payment. Remember, all percutaneous coronary interventions are restricted to a single coronary artery, and each can only be billed as one procedure, regardless of how many lesions are treated within that vessel. However, if 4 or more stents are placed in a single vessel, it is deemed an unusual procedural service and may qualify for additional reimbursement similar to that for an additional treated vessel. For these claims, the documentation should include the correct modifiers to specify which vessel is being treated with the procedure. Modifiers used in this situation include LD, left anterior descending coronary artery, LC, left circumflex coronary artery, RC, right coronary artery, LM, left main artery, and RI, ramus intermedius artery. For additional information regarding billing and coding, please see LCD reference article A57479, Billing and Coding Percutaneous Coronary Interventions. A link to this policy can be found on the resource slide at the end of the presentation, as well as in the chat. So now that we've reviewed what is covered, let's discuss the circumstances for which percutaneous coronary intervention is not covered by Medicare. PCI is typically not indicated for patients who could be medically managed or patients with stable coronary artery disease. Additionally, right heart catheterization and insertion of Swan-Ganz catheters are usually not considered medically necessary for PCI and are likely to be denied. However, they may be covered if deemed necessary when performed in conjunction with a diagnostic catheterization prior to the percutaneous coronary intervention, depending on the patient's specific clinical needs and condition. Lastly, standby services of a surgeon or anesthesiologist are not considered covered services. Documentation for percutaneous coronary intervention should include all medical records necessary to report medical necessity. This may include, but is not limited to, history and physical, including any medical history related to the procedure and relevant results from diagnostic tests and procedures. A permanent record of the procedure must be maintained. The permanent record of the procedure should include information such as details of the procedure conducted, including any contrast media, medications, catheters, stents, or devices utilized, comparison with previous relevant studies or procedures, details related to any notable patient reactions or complications, documentation that confirms all specific clinical questions or findings were addressed or answered, along with an explanation of any factors that prevented the resolution of any questions, and details outlining any factors that hindered the completion of the procedure. The retention of angiographic documentation, either film or digital, and intravascular sonographic recordings must comply with clinical needs and adhere to applicable legal and local healthcare facility regulations. If the provider conducting the procedure is not the ordering or referring physician or non-physician practitioner, that provider must keep a copy of the procedure report and interpretation, as well as copies of the order from the ordering or referring physician or non-physician practitioner. The order must include the clinical indication or medical necessity for the procedure. Additionally, results of all procedures must be communicated with the referring provider. Documentation in the record should justify the need for repeat diagnostic angiography if it was conducted previously, provided there are no new clinical symptoms or indication of disease progression in the past 3 months. Please be aware if the documentation fails to meet the criteria for the service rendered, or the documentation does not establish medical necessity for the services, those services will be denied as not reasonable and necessary under Section 1862A1 of the Social Security Act. Finally, all documentation must be kept in the patient's medical record and provided to Medicare when requested. When it comes to billing, be sure to review the description of the CPT and HCPCS codes to confirm that the codes used accurately reflect the procedure that was performed. Each claim must include diagnosis codes that accurately represent the patient's condition and the reasons for conducting the test. It's important to remember that a payable diagnosis by itself does not establish medical necessity for any service. Additionally, please note that the HCPCS and CPT codes may be subject to CCI edits, which take precedence over this LCD. Please consult the CCI table for correct coding guidelines and applicable code combinations before billing Medicare. Before I finish up, I want to go over a few additional guidelines to follow when determining coverage for percutaneous coronary interventions. The percutaneous coronary intervention should be carried out according to current medical guidelines and standards for the patient's condition. Consequently, some situations may not be covered if they do not meet the criteria for medical necessity. For example, PCI testing exceeding the frequency or duration specified by accepted medical standards is not covered unless special circumstances support the additional medical necessity for the service. Additionally, routine and repetitive monitoring of patients without a documented change in condition, such as new or worsening symptoms, is not deemed medically necessary. In respect to the recovery period following the percutaneous coronary intervention, since an overnight stay is not expected for routine recovery from a PCI procedure, it should not be billed as inpatient services. The routine recovery period should also not be billed as observation hours along with the percutaneous coronary intervention unless the patient has developed complications that require extended monitoring. Furthermore, an inpatient stay after a routine percutaneous intervention would not be deemed medically necessary. Therefore, it is crucial to provide written documentation of any complications or additional risk factors for patients who are admitted to inpatient services or are under observation following percutaneous coronary intervention. Lastly, keep in mind that preventive and screening services are not covered by Medicare unless otherwise specified. Percutaneous coronary interventions are effective, minimally invasive treatments that help restore blood flow, alleviate symptoms, and improve heart health. So as a recap, during today's webinar, we provided background information on percutaneous coronary interventions, discussed coverage and limitation, and reviewed documentation requirements. I have included some resources on this next slide. It contains links to LCD L34761, LCD reference article A57479, and Social Security Act Section 162A1. Please refer to this slide and use it as a reference when reviewing this presentation. Finally, CMS has issued Change Request 13754 titled Disabled Beneficiary Eligibility Information for Mac IVR Systems. Currently, users can still access beneficiary eligibility information. However, eligibility will be removed from the IVR on January 1st, 2025. This initiative is part of CMS's ongoing commitment to safeguard beneficiaries against Medicare fraud. The change is part of a pilot program involving most MACs, and CMS will assess its impact to determine whether the eligibility function will be restored or permanently removed. We have included additional eligibility resources on this slide to assist providers with checking eligibility. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat feature and select Send to all panelists. However, it does look like we're approaching the end of the webinar, and I want to be respectful of your time. I did notice there was a question in the chat, so I am going to move on to keep things on track. However, since we did have a question in the chat, I'm not sure if we addressed it during the presentation, I will look at it and I will send out a question and answer document to all participants following this webinar with the answer to that question. If you do have any additional questions, though, feel free to put them in the chat, and I can send out the answers to that as well when I send out the question and answer document. For those attending today's live event, in a few minutes, you will receive an email thanking you for attending. And the email will look like what you see on the right-hand side of your screen. Do not delete it without reading it. This email contains your certificate of achievement, as well as a link to take the survey. If you haven't completed it already, please take a few moments to complete the customer satisfaction survey. The contact hours for this event can be found in this email should you require them for earning credit to our continuing education units. If you don't see it, please check your junk or spam folder. Make sure to add the WebEx email address messenger@webex.com to your safe sender, safe receiver list to avoid these emails going to junk or spam. If you called into this webinar, just email us at wps.gha.education@wpsic.com with the name of this webinar and the phone number you used to log in, and we can email you your certificate of achievement. Following today's live event, if you think of any additional questions, you have 7 days from today to submit them. Send them to our email education box at wps.gha.education@wpsic.com and put Percutaneous Coronary Interventions in the subject line. However, if you have claim-specific questions, please do not send those to Provider Outreach and Education. Please direct those questions to our customer service department, as we don't have access to your claim information and therefore are unable to look up a claim. Also remember that we cannot accept any type of PHI or PII via email. If you haven't done so already, please take a few minutes now to complete a survey. Share with CMS and us about your experience today. Tell us about what you liked, what we could do to improve, and suggestions for future education. Your feedback is really invaluable in helping us deliver the education you need. We use your feedback to develop topics for future educational events. There are several different options you can use to take the survey, depending on your preference. For those attending today's live event, the first option is to click the survey link in the chat. The other option is to take the survey in the CMS Qualtrics page. When you exit the webinar, you will be asked to go to an external site. The external site is the CMS Qualtrics page for the survey, and the message looks sort of like we see here, with the little yellow triangle. This is not spam, it's actually directing you to our survey. We will also add a survey link to the Encore presentation. Just click the survey picture at the end of the Encore presentation video to take our customer satisfaction survey. On behalf of myself, Elaine, and all of Provider Outreach and Education, thank you for attending today's webinar on percutaneous coronary interventions. As a reminder, this presentation will be posted as an Encore presentation on the Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you at future events. You may now disconnect.